Hello everyone, welcome back to my session. So this is actually a continuation of dissection series, and in this session I would like to talk about the shoulder region, shoulder joint. So when you approach the shoulder joint from the posterior aspect, we have the deltoid covering that region. So first we have to incise the deltoid and separate it from the scapula. That is you have the spinoscapula over the inferior lip of the spine of scapula. You have the attachment of the deltoid and you have to separate it from the scapula. Then as soon as you reflect it, you can see that the axillary nerve is actually lying beneath the deltoid, and that is the reason why when you give injections to the deltoid, intramuscular injections, you have to keep your palm like this, and below this one palm breadth below you have to inject. Otherwise, if you go higher up, you can injure this axillary nerve. That is one point. Then if you approach from the posterior aspect, there are two main muscles, that is infraspinatus and teres minor. You have to cut through these muscles in order to see the posterior capsule of the shoulder joint. Then if you make a vertical cut through the posterior capsule, you can see the head of humerus articulating with the glenoid cavity of the scapula. So that is very important point. Now we know there is one tendon arising from the capsule of the shoulder joint, from within the capsule. That is the long head of biceps that you can see passing through the intertubercular sulcus. So if you trace that tendon into the joint, you can see it arising from the supraglenoid tubercle. So these are the things which you have to appreciate from the posterior aspect. And if it is a disarticulated limb, from the posterior aspect, if you look through, you can see the glenohumeral ligaments which are seen anteriorly, the three sets of glenohumeral ligament, superior, middle and inferior glenohumeral ligaments. That also you can make out when if you look from the posterior aspect, just like a window. Now moving on to the anterior aspect, so all these muscles around the shoulder joint are considered as one single entity known as rotator cuff. So the muscles which are arranged around the shoulder joint, you can think about the muscles from the lesser tubercle over to the greater tubercle. Lesser tubercle, if this thumb represents the lesser tubercle, you have the subscapularis, and the three fingers sit on greater tubercle. That is the code SIT, sit on greater tubercle. So S stands for supraspinatus, I stands for infraspinatus, and T stands for teres minor. So this is how you get the rotator cuff around the shoulder joint. Now you know the entire upper limb is connected to the axial skeleton through one joint, that is sternoclavicular joint. That is, the clavicle is the only bone which is actually forming a joint with the axial skeleton, with the sternum. So if you just separate it from the sternum, then separating the upper limb, that is making the upper limb free, is made possible just by cutting the muscular attachments. So there are no joints after cutting the sternoclavicular joint. That important if you are trying to remove the entire upper limb along with the clavicle and scapula. So just one joint you have to separate, that is the sternoclavicular joint. Suppose you have to keep the clavicle there when you wish to do the dissections of the neck region, you have to keep the clavicle there. In that case, most of us will separate the free upper limb along with the scapula, and we will keep the clavicle there. In that condition, the only joint you have to separate is the acromioclavicular joint. That is between the acromion of the scapula and the clavicle, the lateral end of the clavicle, there is one joint, that is acromioclavicular joint. If you just separate that joint, that is the only bony joint which you have to separate if you want to remove the upper limb, if you want to free the upper limb from the body. And of course, you have to cut through the muscles which are actually connecting the free upper limb with the body. They are, from anteriorly you have the serratus anterior, and posteriorly you have the latissimus dorsi. Okay, so you can cut it. Then you have to separate the trapezius, which we have already done. Then for back muscles like levator scapulae, rhomboids minor, rhomboids major, we have to cut through. And these are the important muscles which you have to cut if you want to separate the free upper limb along with the scapula. So if you cut through all these muscles, you can separate it. Now of course, when you cut, you have to make the vessels and nerves as a single tie, that is neurovascular bundle. You have to tie it and you have to cut through it. So this is about the free upper limb from the shoulder joint. You also have to study the shoulder joint under the main headings like the ligaments, which include the fibrous capsule and also the accessory ligaments. Now you have to think about the muscles, which the main thing being the rotator cuff. Then you have to think about the movements possible at the shoulder joint, like the flexion, extension, abduction, adduction, medial rotation, lateral rotation, circumduction. And you have to think about the bursary related, then some clinical entities like painful arc syndrome, frozen shoulder syndrome.